Welcome to Nurse Talk with Martha and Tessie, where we are making history, we're transforming nursing, and we're elevating our profession to the next level. Well, guys, we have a wonderful surprise today. I have this lovely young lady. Her name is Agnes Chukwu, and she is our special guest today. Agnes, thank you so much for joining us today. Now, Agnes and I, we met at church at around, I think, 2019 or so.
Right.
And Agnes was in nursing school. So she is one of I have so much respect for her and respect for her journey. So, ladies and gentlemen, this is Agnes Chukwu.
Thank you so much for the wonderful introduction.
You are welcome.
It has been a journey. I am Agnes. I'm born in Houston, Texas, live in Fresno, Texas. I started my nursing journey here in Texas. I went to Prairie View A&M University.
All right.
You know. If you don't know now, you know. And I went through my undergraduate experience and I got my bachelor's of nursing. And it's been, a journey since then. A little bit about me. I started here in Houston at a hospital in the step-down unit. And I then, went to ICU. I've traveled. Majority of my experience is step down. I would even say, I've floated. I've seen a lot of different units during traveling. So it's been an experience.
Right.
But yeah, that's a little bit about me.
Right. Okay. Well, Agnes, what made you choose nursing?
Oh, yeah, that's a great question. One of the reasons why I chose nursing, I really don't even say that I chose nursing. I feel like nursing chose me. When I was going to school, I went to a medical academy at Hightower High School. And during my time there, I thought that I wanted to be a doctor. And my mom, she was a nurse. My dad, he was a respiratory therapist at the time.
Oh, really?
So I always had, science influence around my life. So I knew that that was a field for me. However, I said a prayer, and God expeditiously answered that prayer, and from then on it was nursing for me. So that's kind of how my journey went.
That's wonderful. That's wonderful. Now, one thing unique about Agnes, and I would love for her to tell her story. Tell her story is Agnes. Actually, you completed nursing school and everything, and your first experience in nursing was during COVID.
Yes.
Now that's something. This is something that I would like to hear about your experience.
Yes.
And how you felt and things like that.
Yes. So when I graduated from nursing school, I started off in 2020. So I'm a COVID nurse, and that was a very interesting experience coming in at the heart of the pandemic, at the very start. And it was unique in the sense of the fact that almost like there were so many things that had to be expedited as far as the learning experience, because we were dealing with a higher acuity of patients essentially. And there was so much to learn. It was a tough time in a sense because unfortunately we had to see so many people, pass and go through a lot of that. But the experience is life-changing because it really allowed for that critical thinking, allowed for a lot of skills that maybe in regular times wouldn't have developed. So I learned a lot. I think that, pressure makes diamonds.
Yes,
and that was the time. And I think also during that time, we experienced like such a change in culture with, the dynamics of nursing. Because, where there were once so many what I would call seasoned and experienced nurses, a lot of them were leaving the bedside because they had had enough. There was a lot of things that were, in a sense, I want to say, when you have rules and regulations in certain circumstances, they don't always apply in emergency situations because your priority is different. It's an emergency. And so because of that, there were so many things, quality, safety, a lot of things were at risk. And so, it takes an astute nurse, one that is really conscientious of the patient and ensuring that the patient is taken care of, to really have the ethics and the morals to obtain, quality of care in times such as that. So when you constantly are seeing care compromised, especially for experienced nurses who have been in the game and were nurses throughout so many different, challenges, COVID was just different. And because it was so different, I think that it really, not only was it, did it affect a lot of nurses in the sense of like health wise, but health isn't just physical, it's mental, emotional. And in nursing, we use a lot of those faculties, in our care. So it was very different, and I learned a lot. And unfortunately, there's a lot of my colleagues that, I worked alongside. Not, I won't say unfortunately, but, I don't feel like, I would say in my area, that, really got to see, experienced nurses probably in the ways that maybe previous nurses got to see them, just because of the change in dynamics on the units. So yeah.
Okay,
Mhm,
okay,
mhm.
okay. So do you feel like you were given the opportunity to have someone work with you one on one, like as a preceptor? Do you feel like you had enough time before you actually were put on to, given the opportunity to work on your own?
Yes, actually I do.
Oh, that's good.
I had
That's
two
good.
different experiences. So when I was I don't want to say two different experiences. I experienced a change. So luckily for me, when I started to step down, I worked alongside some amazing nurses. My preceptor really helped, form me into like the nurse that I am today, in the sense of like allowing me the opportunity to really just flourish. I think that in that time, I was able to have a preceptor that was far longer in her career than I was. And when I started off step down, that was very different. As my career progressed, I started noticing that, more and more new grads were like becoming preceptors, and precepting, baby nurses. And
Wow.
it was just like very different. So when you see that, you're like, not to say how can a new grad, precept, like, but it's different. It's different in the sense of like an experienced nurse has had years of experience. A new grad, someone that's only been a nurse for 2 years, precepting someone that just came in, is a totally different experience, because they may not have foreseen certain situations and circumstances. So
Right.
I just feel like, during that time, I was able to witness a shift in the dynamics from when I started with my preceptor to like when I was in ICU and I had someone around my experience level precepting me. Great preceptor at that. But just seeing that more as a commonality is a little different.
Right.
A little different. And you know what I mean.
Right.
So yeah.
So do you think that being that the dynamic was like that coming out of school, you had to really be more proficient at what you learned, and then you have other people that have been in the game like a short amount of time. You had to really be confident in what you learned. Did that challenge you in some ways? Or,
Yes, I would say yes. It definitely challenged me to grow. Definitely had I definitely personally had a lot of aha moments or moments where I'm like, ooh, I should have known that, but I didn't,
Right.
And I think as long as you're a nurse, you're constantly always going to be challenged. You're always going to want to be on your A game, but especially during that time because of COVID and just having to be on your P's and Q's about certain things because you don't want to delay care for something that you should have jumped on.
Right.
So I think that there was that pressure to be, I don't want to say more experienced, but be to really take your experience seriously and take opportunities to learn, to put yourself out there, because you never know where, it's going to take you or what's going to happen next. We didn't know how bad it was going to get. It could have gotten way worse than what it was. So I do definitely think that I was put in the pressure cooker and I was forced to cook. So
But looked like you survived.
I think I got a little warrior marks on me, but I will say that I did survive. I survived a lot of different instances, and I'm grateful. I'm grateful because it was a time.
Yes. Now, Agnes, you seem to be very mature. Okay.
Am I?
Yes.
Stop the camera.
And I mean that to say, and I mean that to say, you seem to have good communication skills. When you speak, you're very confident. Can you tell us about where that came from? Because some people, they may not have that, and there was they may need a little help in the area. Can you tell me a little bit about where that came from?
Well, I am Nigerian. And, I forgot to mention that. I am Nigerian, and I think the communication skills, which I'm constantly always working on, I'm a work in progress, comes from, my upbringing. My parents are very direct people.
Okay.
And I think, everybody doesn't appreciate that. Sometimes I don't even appreciate it. But I think that, living in a household where my parents were so direct with me, it made me have to stand on, what it is that I want to say and get it out and stand up and advocate for myself.
Okay.
So because of that, I essentially do the same thing everywhere that I go.
Okay.
I'm constantly, making sure that, when I'm in spaces that I treat others the way that I want to be treated.
Right.
And, I find it very, I want people to understand me. And I think communication is a big part of that because, in nursing, that's a big part of our job. We have to be able to communicate not only to providers, but to, aides, to caseworkers or managers and, janitorial staff. There's so many parts of the team. A lot of people think that nursing is just, you go in there, take care of the patient, but we do a lot of administration work where communication really comes in handy. And so when you are a nurse, you're not only to be versed in the clinical aspect of it, but you also need to be a people person because you are servicing people. And a lot of times, as nurses, we prefer one side of the area than the other, and because our job does get stressful, and communication can get a little touchy or touch and go when you get into really critical care, or when you're really busy or overwhelmed, or you're not in a good work environment or have a good team. Sometimes communication is the last thing on your mind. So it's something that I think even nursing, being a nurse, has actually caused me to slow down, be more patient, and even talk. I want to say talk down, but they teach us in nursing school, like tone down on the medical jargon. You have to. I hate to put it like this, but you have to know how to have a little street talk. Okay, you can't just talk up high, and because sometimes you got to talk at a third or fifth grade level or first grade level sometimes. Because depending on the population that you're getting, you have to be able to communicate to all spectrums and backgrounds of people. So I'm a work in progress.
We all are. And as we grow, then we pick up skills, that will help us along the way. Now, was that something? Did they teach you some of those things in nursing school, like communication? Okay, that's good to know. That's good to know because not all of us are good communicators, and I think it's because of our backgrounds. A lot of times, if we grew up with siblings or who our parents were, things like that. So those are some things that I think we have to work on on our own
Yes.
to have better communication skills.
Yes.
Learn how to play with others better.
That's a good one right
Yes.
there. Put that in your notebook.
That's right. Because we're
Yeah.
not going to always get our way,
Yes.
but we want to come
Absolutely.
off and be respectful to others.
Yeah, I agree.
Mhm.
100%.
Uh-huh. Well, what made you choose? I know you have worked in several different areas of the
Mhm,
hospital. So, what made you choose the area that you worked in? Did you go to other areas? Could you tell us a little bit more about that?
Well, one of my biggest passions that I realized in nursing school was that, like, I was trying to figure out, like, what specialty do I want to work in? Like, I don't like, and initially it was NICU because I was like, I enjoyed my rotations in the NICU actually, but as my career, as I got through nursing school a little bit more further down towards the end, I realized that I really, really enjoy adults and I like working with seniors. So working with the geriatric population, majority of that you're going to see working either, you can see that in all spectrums, okay? Let's be real.
Uh-huh.
But I enjoy the critical nature of like ICU and step down. And when I got out of nursing school, I was a little intimidated to go straight into ICU because I was like, "Oh, that's gonna be a lot," okay? But as I think I did a rotation at a hospital downtown, and when I was there, I don't know, they just let me be a part of the team, like
See,
for
that
real.
makes such a difference.
And
yeah.
I think that I just kind of felt comfortable. And
Mm-hmm.
I remember the nurse that I had that particular day, she was really busy. So she kind of like let me be a nurse, you know?
Okay.
You know,
Okay.
because sometimes you get people that will kind of let you be an aide.
Right.
But it
Mhm.
was different in the sense of like I was able to actually be a part of the team,
Right.
ask the questions. So
Mhm.
I don't know, that stood out to me, and I was just like, I think this is where I belong. And
Right.
from there, I've done ED holes, I've done ER, like I've floated a lot, let's say that. But primarily I've worked step down, I've worked a little bit of ICU, floated med surge. Those are kind of the places that I live in. But I really enjoy intermediate care or step down because you get people that are not sick enough to be in ICU,
Mhm.
but not well enough to be on med surge.
Okay.
And I feel like it gives you a space to kind of like practice, your critical thinking a little bit more. And I like ICU for the sense of like you can straight critical think,
Mhm.
So those two I would say like are kind of like my favorite.
Right.
Mhm,
Okay.
mhm.
Okay. Emergency room. Oh my goodness.
I know,
that is-
right? That's not my favorite, but
That's great.
yeah, I'll grow in that soon. So.
Right. Do you find that working in areas like that gave you the confidence to move to other parts of nursing? Do you think?
I definitely think so. I definitely think so. I'm not going to lie. Yeah, I definitely think so. Like, I think working, hands down, 100%. I recommend me personally, if I were to go back and do it all over again, I think that I would have just pushed myself to go straight into ICU. Me being me, okay? Because I feel like once you get, the best thing that you can do for your nursing career is start at the hardest level possible.
Yes. Uh-huh.
That way you develop that skill set to where, like, for me, like when I traveled, I just felt like, the sky's the limit because you have the skills that you need essentially. I mean, of course, are there areas that you need to grow in as you go? Absolutely.
Mhm.
But don't be afraid to ask questions. So I recommend if people ask me, I'm like, choose what you want, but this is my recommendation from where I'm coming from, and it's done me well, and I'm happy. I don't know, everybody doesn't have the same story,
Right.
but for me, I'm very grateful that I chose the route that I chose.
Right.
So, yeah.
Yes, yes. And I think that's good because if you start at the hardest place,
Yes.
you can work anywhere. Anywhere. That's what I found in my career is that I started in IC. I don't think we talked about that.
No,
Oh, we did. Okay.
Yeah.
All right. Okay.
I was like, really?
Yes. And that has helped me because it's like you can adjust to different areas. If you had like some of the worst experience, that's but everybody can choose what they want. But it makes you so marketable.
Yes.
Tell me about that. When people find out that you're worked ICU, what has been your response?
I definitely think it's like the marketability, which I did not think of, like picking that but it is true. You have a skill set, you think critically, you think in detail.
Yes.
Like there's so many transferable skills. So like if you do want to transition out the bedside or do something else, like the sky's the limit because but I don't think they really taught you that. You know,
No.
I think they taught us a level of that for acute care. But as far as like expanding your career beyond working in acute care settings, it's not really taught. Like start here because if you start, not to say you can start anywhere and get opportunities, but I think the biggest thing is wanting to learn and wanting to grow.
Right.
Because like I could have started med surg, but if I showed, you know, my manager or my director that, hey, like, can y'all float me to the ED? Like, you know how they taught us, they told us that a lot in nursing school. Like, I don't think that I took that as seriously, but, you know, I think that there's so many things that you can use in nursing that can take you a lot farther and market, like make you like, I don't know, like an outstanding, you know, different, I don't know, nurse. Make you stand out. Those skills that make you stand out from the rest or your competition.
Right.
So, yeah,
Right.
I definitely agree. Like it has taken me far. So yeah.
That's good. That's good. That's good. Now, Agnes, I'm going to ask you a hard question. Okay.
Really? Oh God. Do we need to stop the camera?
Okay. So how do you handle conflict?
Ooh, are we on an interview? Really?
Yeah.
Can I be honest?
Yes, please be honest.
When I am faced with conflict on the job, I have to check myself.
Okay.
Okay, because it's really easy to get an attitude. I'm a very direct person. I can be very blunt at times, and I don't mean harm. I just mean to like clarify, you know, because I'm going to advocate for myself.
Right.
So sometimes, you know, when conflicts present itself, you know, I have to take a step back and I have to, you know, check myself so that I'm not taking anything personally and I'm addressing the problem at hand.
Right.
So, you know, we get so many reality checks with conflicts, you know, in nursing, you know, we're faced with nurse bullies sometimes.
Oh, gosh.
And, you know, you have to take the high road, and the high road is not always easy to take. But what I can say is that, you know, in times of conflict, you know, my parents always used to tell me this growing up because I had a smart mouth. They would always tell me sometimes, you know, it's better to be quiet and say nothing than to say something that you're going to regret. Really, my mom would tell me that a lot.
Really? Okay.
She still tells me that today. So that just tells you where I'm at.
Yeah.
But yeah, it's that's the best advice that I can get.
That's really good. That's really good. It is, because we all come from so many different places, and that's really good to, you know, just see the process of, you know, what makes us up. I always say that it's a matter of putting the pieces
together
of the puzzle together as time goes on.
Yeah, you're right.
Okay, here's an easy question.
Okay. Now easy.
What keeps you grounded?
That's easy.
Okay. Yeah. See, I got
God. God. Yes, I definitely. What keeps me sane and grounded is Jesus Christ, my Lord and Savior.
Yeah.
Because I can get very nuck if you buck. And throughout, I think the best decision, if I have never made any good decisions in my life, the best decisions I have ever made in my life, and I'm so grateful. Even till today, I'm grateful to my parents. Yes. I'm grateful for like really just taking my personal relationship with Christ seriously, because as I've gotten older, it has just, the return on investment is just over compounding over and over
every
again. Because you know, you could really be on the wrong side of the railroad track sometimes. I find myself in situations where I'm like, what would Jesus do? Because what Agnes is gonna do is not effective or politically correct. So, yes, God keeps me grounded. Prayer, constantly just keeping my mind, fixed on Him. I am not perfect by any means necessary.
100%.
My walk with Christ is not perfect. We got crooks in the road every day, okay? But He's with me, okay?
Yes.
And I know that, like His word said, He is not going to forsake me. So that's just very reassuring,
Yes.
because it's not always, don't always have good days, but with God, it makes it bearable. So
Yes.
I'm grateful for that.
Yes, all right. Well, last question.
Okay, now that.
I agree with you 100% on what you just said, okay? But last question. Tell me, where do you see yourself going next in nursing?
Wow, that's a loaded question.
That's
We
all
can go
right.
on and on and on. As far as like my career in nursing, I just see myself constantly evolving. I recently, I didn't talk about this, but I work with an amazing company, and I work in community health currently. And so I have been exposed to so much being in the community setting, and it's so different from acute care. And I love that because there's just when you think you've learned, there's so much more to learn. There's so many ways to grow. And that has like really pivoted me in such a different direction. For so long, I had like been praying, asking God, like, what do you want me to do? Like, I always know that I wanted to go back and get my business degree, which I actually recently graduated last year. So,
Congratulations.
Yes, thank you. And so I really, like, as far as moving forward, I really want to couple like my health background as far as nursing and business, so that I can move forward and like kind of do like something as far as, helping seniors in that direction, which I'm really excited about because I do have ideas, and I've actually even had more ideas since we last talked.
Right,
So
good.
I have some things in the background that's loading, and I'm super excited about that because I know that it's needed. And, I know that it's going to make an impact for the population that I'm designed to serve. So I just pray, okay, that the resources and are just aligned, and so that like even doing things like this,
Yes.
speaking more, and educating the community is so important. So I'm excited. I think nursing has so much in the next 5 to 10 years. Nursing and business. That's my goal. So yeah,
that's awesome. That's awesome. And I like the fact that and I think people need to know more about that nursing is not just bedside,
Yes.
which bedside is very important,
Right.
definitely important because we
Right.
all need that.
Right.
But even you said about community health,
Yeah.
can you just tell this? I told you it was the last question, but can you just tell us a little bit about when you say community health, what you mean by that?
Yes. So with community health, community health is like serving the community in a sense. So specifically with my job, my company focuses on the IDD community.
Okay, what's that?
So that's like mental health special needs.
Okay.
So a lot of them have like psych diagnoses, but they also have developmental delays.
Okay.
So it's just very interesting because there's so much that the community has to offer, and it's not just mental health or special needs. Like there's seniors, like when you think about home health agencies or skilled nursing facilities or assisted livings, like there's so much in community that like comprises or makes up community health, and it's very large, but like I think it's like not really talked about, as far as like nursing. Like a lot of times you're pushed into acute care or, like more so like hospitals. When people think of a nurse, they think about hospital, but we forget that nursing started at home.
Right.
If you really look,
that's really
like,
good.
Florence Nightingale, a lot of these things that we see today have evolved, and even like programs like insurance, like nurses work in insurance, nurses work in finance, nurses work in so many sectors that go beyond the bedside and actually tie into the community. And so I think that like as I have been exposed to this community, like, or the community setting, it has really opened my eyes and made me realize that there's such a need not only here but just in different areas and aspects of nursing. So that's one thing that I also want to like encourage like newer nurses, like look outside of that, because people complain about we're not knocking the hospitals,
right,
but like so many nurses lately after post-COVID are burnt out and complaining about the hospitals. But what if we still worked in hospitals, but we also supplemented it with like doing something that was maybe that wouldn't give us burnout, you know? Like IV clinics, IV hydration is a thing that's in the community. It's not community, it's aesthetics, but you know, so but it does serve community sometimes, because when you couple IV therapy with home health agencies, then you know you get you know what I'm saying?
Right.
So you kind of have to, you know, kind of tailor your nursing career to like what I guess best serves you in a sense, as you serve people, so that way you're serving them with excellence and not with being burnt out because you know you wanting to like the first opportunity that you get is acute care. So that's what I'm learning, you know, at least.
Yes,
so,
yes. Now everybody, now you see, now you see how just speaking to someone who is starting nursing school or someone that's maybe thinking about it, how important it is for us as nurses to share our experiences, so and to let people know, because there's a limited amount of time you have in school, so we need to see as much as we can as far as who's doing what, the different options, because I am a firm believer when you do what you enjoy doing, it will not seem like work.
That's so true.
And so nurses, please just, you know, share your story with others, and we want you to share your stories on here as well. I wanted to say to Agnes's parents, you all did such a wonderful job. You know, the moment that I met Agnes, and I could just feel her warmth and the depth of what a wonderful young lady she is.
Too many good words. I'm not that wonderful.
It's real.
I have my bad days.
So you did a wonderful job, and Agnes, thank you so much for sharing your story.
Thank you for having me.
Yes,
it's been a pleasure.
yes. And like I said, we want to hear your stories. You can drop us an email and let us know if you'd like to come on and tell your stories, because all of our stories are so different, yet they're so important to share. So please don't forget to hit like, subscribe, and hit the notification bell. And we are so happy that you joined us today, and we will see you on the next episode. Have a great day. Bye-bye.